Why are personalized mantle cell lymphoma stem cell transplants evolving? Imagine how much cancer treatments have changed over the years. In mantle cell lymphoma, a type of non-Hodgkin lymphoma, the way doctors approach stem cell transplants is also shifting. This evolution is driven by new discoveries and better tools to understand the disease. Instead of a one-size-fits-all approach, treatments are now more tailored to each patient's unique situation. Traditionally, younger and healthier patients with mantle cell lymphoma often received intense chemotherapy followed by a stem cell transplant to try to eliminate the cancer completely. But recent research shows that not every patient needs this aggressive step. For example, some studies suggest that if a patient responds very well to modern treatments that include targeted drugs like Bruton tyrosine kinase, inhibitors, and immunotherapy, they might avoid the risks of a transplant altogether. This personalized approach helps reduce side effects and improves quality of life without sacrificing the chance of remission. Another key reason for this change is the ability to measure minimal residual disease, or MRD. MRD testing looks for tiny traces of cancer cells remaining after treatment. If a patient tests negative for MRD, they are less likely to relapse and might not need a transplant. Conversely, if MRD is still present, a transplant could be more beneficial. This risk-based decision-making allows doctors to better predict who will benefit most from a transplant. In addition, new cellular therapies like chimeric antigen receptor T-cell therapy are emerging as options for relapsed or resistant mantle cell lymphoma. These treatments can sometimes replace or delay the need for a stem cell transplant, further personalizing care. The choice depends on the patient's disease status and overall health. Age and fitness levels also influence treatment plans. Older or less fit patients may not tolerate the intense conditioning regimens used before transplants. For these patients, doctors are exploring less aggressive options, including novel drugs and antibody-based therapies, to control the disease while minimizing harm. Ongoing clinical trials are crucial in shaping these changes. Researchers are studying whether some patients can safely skip transplants altogether or if newer therapies can be used instead. These studies help develop guidelines that focus on individual patient profiles, disease characteristics, and how well the disease responds to initial treatments. In summary, the evolution of personalized stem cell transplants in mantle cell lymphoma reflects a broader understanding of the disease. It's about balancing effective disease control with reducing treatment-related risks. As science advances, treatment decisions are becoming more precise, aiming to give each patient the best possible outcome based on their unique situation. Always remember, discussing these options with a healthcare professional is essential to find the best approach for each individual.